always believed God allowed bad things to happen for a reason. But as fall of 2008 came to a close, my youngest brother Nathaniel fell victim to a detrimental disorder. What seemed like a few curves in his spine turned out to be severe juvenile scoliosis. Today I want to answer 3 questions about scoliosis. First, what is scoliosis? Second, what are the treatment options? And third, what is the impact scoliosis has had on my family? This is the truth about a disorder that claims the joy of thousands. So what is scoliosis? Well, according to the National Scoliosis Association, it is, quote, a musculoskeletal disorder in which there is a sideways curvature of the spine, end quote. This causes left, right, in, out, and or twists in the spine, affecting 3% of the population. Juvenile scoliosis specifically affects 0.04% of children ages 4 to 10. Birth defects, tumors, infections, connective tissue disorders, cerebral palsy, muscular dystrophy, and metabolic and rheumatic diseases make up the only known causes of this disorder. However, the cause in 85% of cases is unknown or considered idiopathic. Unfortunately, Nathaniel has idiopathic juvenile scoliosis, the most mysterious form. Let's examine how the spine works. Series of bone discs with cartilage cushioning construct the majority of the spine. These discs support the upper body and protect and deliver the central nerves to the entire body. A healthy spine curves in many locations, but never laterally. Scoliosis causes the spine to form C or S shapes. To determine the severity of a curve, doctors measure them in degrees. According to the University of Maryland, quote, a curve less than 20 degrees is mild, 25 to 70 moderate, and 70 and above severe, end quote. Symptoms such as limited mobility, pain, reduced breathing, uneven hips, shoulders, and or shoulder blade protrusion result from scoliosis. In extreme cases, curves may prove fatal by pressing organs, prohibiting breathing, or causing disabilities. According to Dr. Roy, chief doctor at Columbia University, quote, the curves in juveniles often progress. 7 out of 10 will worsen and require active treatment, end quote. This leads me to my second point. What are the treatment options? As of 2011, bracing is the standard treatment, slowing progression rather than permanently correcting a curve. The Boston brace is the most common brace and extends from below the breast to the beginning of the pelvic area, encasing the torso. This focuses on the lower spine by using foam pads as pressure points. The most scary looking, yet another common brace, is the Milwaukee. This extends from the neck to the pelvis with a plastic girdle and neck ring connected by metal bars, centering the head. Foam pads then attach to these bars with Velcro. Nathaniel wore both of these braces, but in his case, along with 30% of juveniles, surgery was necessary. The American Association for Neurological Surgeons determined that if a curve grows greater than 30 degrees, surgery replaces or couples a brace. Today's most common surgery for juveniles is growing rod surgery, in which metal rods are attached to the top and bottom of the spine with hooks and screws, and lengthened every 6 months. Once the patient matures, the rods are removed and the spine is fused with a bone graft. Unfortunately, the Scoliosis Research Society found that, quote, this has unfavorable effects on the growth of the lungs, thorax, and trunk, end quote. The latest surgery, however, is tethering, in which doctors cut through the chest, adding screws to the spine, which are then attached to a flexible ribbon. This helps direct spinal growth. However, few of these surgeries have been performed, and their long-term effects have yet to be determined. Even so, according to Dr. Weiss, a worldwide doctor, writer, and speaker on scoliosis, quote, no study over any time has provided substantial evidence to prove surgery as a scoliosis treatment, end quote. Due to these risks, alternatives such as chiropractic treatment and Schroth therapy have attracted a handful of people. Schroth uses a physiotherapeutic system of exercises to strengthen muscles curves have crunched and shrink overdeveloped muscles. Multiple European studies found that this helps to improve posture, increase lung capacity, reduce pain, reduce curves, and most importantly, avoid the surgeon's knife. The Rigaud-Chenot brace often accompanies Schroth and looks like a full thoracic cast, helping to elongate and normalize the spine. Even so, Schroth has yet to gain popularity in the U.S. As expected, everything from diagnosis to treatment drains victims and their families. This leads me to my third point. What is the impact scoliosis has had on my family? Let's turn back to Nathaniel's story.